Hi, I'm Dr. Dean, and this is a short instructional video just on cycloplegic refraction. So cycloplegic refraction is used in a variety of contexts, but normally in the context of children. So children aren't easy to refract. If you put a child in a phoropter, so a phoropter is the machine where we put lenses in front of the eye and change the lenses and ask you what is better, one or two, and get responses from you to help guide us as to what lenses and what glasses script you need. In children, firstly, they often don't let you come near them. Putting lenses close to the eye, putting their eye in front of a phoropter, they really struggle with that. Their responses to whether something is better or worse is also often inaccurate, as well as children have an extremely strong ability to accommodate. And what that means is they can change the strength of the lens in their eye a lot. So they may be focusing in the distance and then near and far and near, and so their glasses script can change the whole time you're trying to test them. And so we can't really use a phoropter and your traditional way of assessing for glasses. So how do we do this? How do you test glasses in children? And obviously there's a lot of contexts where it's essential to get the correct glasses for children, especially if they have a squint, if they have amblyopia, or one vision is a lazy eye, etc. It's really important to get this right. The way we do it is with cycloplegia. So what that means is we give eye drops, right? There's a few different types of drops that can be used. Often they have a red top, but not always. And essentially those eye drops paralyze the muscles of the eye and they dilate the pupil. And we want both. By paralyzing the muscle around the eye that changes focus from far to near, it means the eye's focus isn't changing the whole time, which means when you're doing a reading or an assessment, their glasses script isn't changing the whole time. So that's really useful. The other thing is having the pupil open, it's easy for us to do retinoscopy. So we dilate the pupil, we paralyze the muscles, and then we use a retinoscope, which looks like this. It's a device that has a slit beam on it, which we use to check a light reflex over the child's eye. So we look through this hole and we look into the child's eye, and by just shining the light through the pupil, we see a light reflex. And then by placing different lenses, so we have a variety of different strength lenses that we can use. We normally place the lens up towards the child's eye, we put it in front of the lens, and then by doing that we are able to assess what the strength of the glasses script is, and that gives us a much more accurate reading of what prescription needs to be, what prescription is required for the child. This can be done in patients who are unconscious as well, who can't respond. So there's other scenarios where one needs to do cycloplegic refraction. But essentially, if you have a child that has a glasses problem or has a squint or has a problem that requires or an assessment for glasses, you may need a cycloplegic refraction. What is important is normally we need to see children prior to dilating them, because when we put the drops in the eye, it does blur the vision. And so normally there's two parts to most consultations with children. The first part is assessing them undilated or uncyclopleged. We can check the vision, we can examine the eye, and then at either the same day or at another visit, we apply the cycloplegic drops, dilate the pupil. That allows us to firstly look at the retina, look at the posterior or the back surface of the eye, and then to do a cycloplegic refraction, to do a glasses test. So just so you know, if you have a child coming in for a consultation, it may require two steps: an initial consult and then another consult for cycloplegic refraction, because the drops themselves can take time. Sometimes we like to use drops for 3 days, sometimes for a few hours, so sometimes it's not practical to do that on the same day, and you may need another consultation for that. But that's the basics of cycloplegic refraction, why we do it and who needs it done. But if you require more information, please just feel free to reach out and contact us.